show up. I think it's really nice story.
Okay, so how me and Emma met is we stalked each other on social media period of time, and then we came to mine and we had tea in the allotment.
We did.
And I then came to you for some Reiki, and just through conversations and stuff, we connected. And then I had joined the British Society of Lifestyle Medicine as a member, and then got involved in their Voices of Lived Experience group, and you were like, I want to get involved.
Why didn't you invite me?
So then you came, and we then went to Brighton last year, and we're at the conference and had some really great, really interesting conversations. And we want to expand those conversations out, because lived experience, I think, is still so overlooked, and it's so valuable. And I understand where healthcare professionals come from. It needs to be evidence-based, we need to back up. But what better evidence is somebody who's sitting in front of you, telling you their story?
This is what happened to me, and this is what failed me, and this is what got me well. And I think, I think my turning point in confidence-wise was being asked to go down to the NHS conference like last year and speak. The kind of what I loved about the way she spoke to me, and it was actually the lead research nurse, both of them, specialist nurse, and they run this conference for Manchester Eye Hospital, and so it was all clinicians. So it was like, how do I, because I'm talking to people normally about how things show up in their body and stuff like that, and my own story, but actually it was like talking to people that don't know, because they don't. And that was what fascinated me, was you're expecting, oh God, I don't know anything, and I'm going there. And actually, they're asking me for advice about, and actually I've had a call since then from one of the specialist nurses, is like, can I pass this person, give them your details, because this is what they're struggling with. And I think that's really important. That's a really important part of what we're trying to do, is to build relationships with clinicians to say, look, we're not doing your job, but we can support you in ways that you can't support other people. And it was lovely on one of the podcasts that we did have a GP with lived experience, and the insight that gave was incredible, actually.
Yeah, because you don't know what you don't know. And I think a lot of the clinicians are stretched because they just don't have enough time. And also they're limited to what they're allowed to say. There's lots of red tape. This is your role in the world. And I think I certainly grew up thinking that doctors and clinicians and everybody were on this other level. They were this holy grail of all the information, and it was only through personal experience of dealing with them you go, actually, they're a human being.
Exactly that. They only know what they know. I mean, when I was diagnosed with Graves, I can remember the GP saying to me, like, when are they going to sort this out for you? And I was like, I've had autoimmune disease from like early on. And he was like, when are they going to sort it out? And I was like, well, my thyroid is leveled out with medication. And it was kind of, I think it's those moments within those spaces where you go, I actually know more than you. And of course I should, because I've lived it. It's going on for me. So I know how it feels. And I know when I worked in hospital, it was very much about, if we're working with people with a chronic diagnosis or maybe cancer diagnosis, the person involved in it was less stressed than the people around, because actually they know, they hear it, and it's like, finally things are making, sense to them. Like, all of this stuff is now put into a diagnosis. And I think for me, the diagnosis was one part of it, and then the journey after is like, now I know this, what can I do about it?
That's what it was like for me. It was like, got this diagnosis, and initially it was like, okay, they're going to help me. And very quickly I was like, oh, they can't. I'm going to have to take a lot of responsibility here myself. And that was something that really came out when we were at conference, was that, I think it was Hollyanna's radical responsibility. Like, you have to be able to take responsibility. And I think it's easy for us to say that because that's our mindset and that's how we do things. For people who are less belligerent than us.
Waiting for you to say that word.
I think for a lot of people, they need to hear success stories. And I know in my experience, I was never pointed to success stories. I was told the worst case scenario. This is the potential of the outcome in the most negative way, not the most positive way. And all the research around placebo and mindset talks about, if we give people hope, they are much more likely to have better outcomes.
So
So yes, prepare people for worst case scenario, but give them the light at the possibility.
Yeah. Show them, and in actual fact, that's what came up in a lot of our conversations with the GPs and practitioners afterwards. That said, what about the people that are struggling? Right, we can use this as examples. This is what our page is for. But also, you've got to think outside the box a little bit and know that some people, for them, it's just going to take a bit longer, or it might not happen at all, and that has to be okay. And this is the other thing, isn't it, of like change within that thing. So I think it's really exciting. And obviously we've done a couple of pillars of health workshop, and we've kind of played with what we've learned around lifestyle medicine and what we know. And then I think this is what kind of came out with it, was this: we need to invite people on to actually discuss more of this, not just our own situations, but what I noticed, because we've kind of block recorded them, what I noticed the most was the similarities in the stories, how this I just didn't know, and so I found out, and this radical self-responsibility, which is no one's coming to save me and I need to come and sort it out.
Yeah.
So I'm really excited about who we're going to interview next year already. I mean, we've kind of done really well this year, but I think such a lot of focus on it next year of bringing this about, because they are like massively important conversations, and we're actually, the nice thing about it is a lot of the people that have had lived experience are working in different fields now because of what they found out. And what's nice about that is that it's opened up a whole world of people for us to refer to, learn from, and I can't see that there's anything ever going to be wrong about that.
And it means that it's helping take the pressure off the health service, because they should be there to deal with the acute, my God, urgent situations. The rest of it has to be elsewhere, because the system's crippled already. It cannot cope. And I was telling you yesterday when I saw you, my cousin was diagnosed with diabetes years ago, and my aunt has just recently been diagnosed, and he said he has noticed a huge decline in the level of support and care that he gets and how to manage a condition, because my aunt's been given nothing. She was basically, here's, inject yourself, on you go.
Yeah. It's really bad actually, because I used to work in like a rheumatology department where chronic, really young girls were being diagnosed with like lupus, which is, really tough. It affects every part of your life. And there was a system in place. Like I would counsel them immediately, get them to their medication, book their next appointment, because you come out like, do you know what I mean? Like completely shaken at 21, and all you want to do is go out and have a drink after that, because you just, so annoyed. Giving them some really basic information, then seeing the specialist nurse, then getting meds, and there was a system in place that worked. There were GP letters sent, there were letters sent to you so that you could take that in slowly and gently, because knowing what I know now, about how information is brought in and how we do it gently, it makes a change. It's tricky. It's tricky to see what's happening right now. And I still hate going to the GP. I hate it. And the way that it's managed, particularly I think since COVID, where we had to manage this situation like this, and that's going to now carry on, even though we're out of the crisis, and I'm not sure that it might work for the clinicians. I've put a post out about this, obviously, but it's not really working for the patient.
Yeah, there's lots of, they always have these buzzwords of patient-centered approach and all these phrases that they have out there. Trauma informed, and what do you mean by that? Because you're not actually, if you speak to any patient, every patient will tell you that they're getting fobbed off. So this is a person-centered approach. Every patient that goes in and is told that they've got this life-altering condition, diagnosis, whatever it is then either gone, well, you'll see a consultant in a couple of weeks, or here's a bunch of information, but there's no trauma informed, because there's no recognition that the person you've just shared that information to has just gone, oh, fucking God, what the hell is happening? And their head is not in the room and they are not dealing with them. So there's no trauma informed there either.
I think anywhere where there's not a front-facing role in chronic illness, it's always going to be tricky, because information is, it's got to be absorbed slowly for you to take. And I think when you're smacked in the face with, this is your diagnosis, there's your medication, on you go, then that's what you do. That's what I did. And then it wasn't until things got worse and no one had said, if you stop doing that 10 years later, then that might help. And I'm like, really? Do you know what I mean? And then that was the turning point. So from 17 to 23, I was kind of lost, and kind of just taking what was given. And it wasn't until all these other symptoms came up that I was like, oh God, I'm not coping with this very well at all. Probably very depressed as well at the time. Yeah. But I think what has been so positive about the conversations that we have had is the knowledge that people have about, you know, the in-depth knowledge and a passion that people have for supporting people in what they do because they know it works. And the other thing was how many of them was like, you know, look internally for the answers, which is, yeah, I mean, that's my mantra, right? So, but yeah, it's been so interesting. It's been really hard work. I don't think either of us realised like how much hard work it would be on top of what we were already doing. So this is why we get a day to go and co-work, and you buy me tea so we can work together and then go and have a big fat cake.
We can, yeah, we need that focused time to just sit down and go, right, what do we need to get done? So we're doing that on the 2nd of July, 2026, not 2027, because that's a whole year away.
But 2027, we're going to have a space, we're going to have regular time, guests are going to be brought in. This is going to be, next year, it's going to be me and you, pal.
It sure is. But, you know, so we're sitting at, my words have gone, we're going to sit down on the 2nd of July and get shit done and start scheduling out. So from probably the following week or something, we'll start having feeding the episodes out with little clips from them to give you a taste of what's coming up. I'm buzzing.
I am really excited. Like, I mean, I've got a week off my own work, and I'm just sit in an office with you and do work around podcast. It's crazy. That's how much of a geek I actually am.
I'm just going to do something to you.
Well, it matches, yeah. You match me anyway in that geekiness. But I think it's going to be on YouTube. We'll get it on Spotify. All the you know, you're more about all the channels because you've got a good old podcast going anyway for your own work.
We'll get it on all the platforms. I think Apple takes quite a wee while to approve you. I can't remember how I did that because it was like 10 years ago or something I originally did it.
Well, check it out. But I think, you know, the information in it, and I think from that information, I think we've got, when we sit down with this beautiful spreadsheets, because I love a spreadsheet, then you know, finding out how we can set up, you know, maybe a course through that, and also a referral program, I think, for people to actually, not just in the show notes, not just what was interesting, but actually a referral program, especially for me. I'm really looking for people, particularly in Scotland, that can really support that. So yeah, that's really interesting.
Lived experience, trusted, yes, definitely. Yeah.
I can't even, because we blocked so many recordings in the last one. I'm like searching back over the last year and trying to find out, but there's been so many, and trying to hold you back from asking more questions has been kind of fun.
It's been an education for you. How do we rein Jen in?
I'm bad sometimes, but yeah, like keep the questions to this.
No tangents, Jen, no tangents.
So we're hoping after next week that, and I'm going to put the page in the notes below as well, because you know, that's where a lot of the information will go up. That's when you'll hear about new things coming out. That's when you'll hear about next year and who we're interviewing and stuff like that, because we're going to have a bit more order about it. So yeah, I'll put the link in our new page that I so kindly did. It took ages, by the way.
I'm grateful to you for that.
I bet. I'll be saying the same to you about Apple and YouTube, don't worry. It'll be fine. So we can be looking out kind of mid-July at least, mid to the end of July at least, when we're getting some of these episodes out. And obviously we'll put a collaborative post on yours and my page so people can start following us over there. And also, you know, for next year, if anyone really has a great story, a great lived experience conversation that they want to share with us, then we want to really hear from those people as well, because I think there's so many people that we don't know and so much information that we could share with others. Then, you know, great.
It doesn't need to be somebody who's got a business off the back of this or is anything like that. It can just be somebody that's got a really inspiring story that's what their passion is, that they want to share as their story, not to try and get clients or whatever. So
it's not for monetary value or anything like that. It's really for us, it's to share the information without teaching it. You know, it's kind of just going through the process of letting other people tell their stories, so that, like you say, there's that glimmer of hope, and then maybe we can use that as a resource for our own clients as well, which is brilliant. I just think that there's a no-lose situation here, and all I can see is kind of growth and collaboration and wonderfulness.
Yeah,
that's the word.
We like to make them up.
So is there anything else you would like to say before you head off for your lunch, my darling?
No, I'm hungry.
Okay, let's get you away for your lunch.
Thanks, at 4 o'clock in the afternoon.
4 o'clock, yeah. Well, you know, sometimes we live a different timetable. It worked for us. That's the way it's
Yes,
got to be.
that's what's right for you.